So the facelift that I undertake would be one that's a fairly standard facelift for surgeons to do. It involves an incision which starts in the hairline, comes down and just hooks in front of this part of the ear, hooks up under the earlobe, and then behind and back into the hairline. So the potentially visible scars are kept to an absolute minimum, and they're hidden in curvatures around the ear. It involves a general anaesthetic. It usually takes about 4 to 5 hours to undertake. And really the main part of it is the older type facelifts, and what people are really worried about, they're going to have an obvious look or an operated on look, or this windswept sort of appearance where they're sort of swept back like this, which is the thing most people are scared they're going to look like. A good facelift is really just about resuspending the tissues, and then the skin is just redraped where it needs to be. So the amount of skin that's removed these days in a good facelift is minimal, whereas it's a matter of resuspending those tissues that have descended, like particularly in the jowl and the neck, to resupport it so that people don't have that operated on look. That older facelift where people, it was a matter of really just stretching the skin, and there was a couple of things with that. One, they didn't look very good. They looked like they were significantly operated on. The scars often stretched and were fairly obvious and made thick scars and wide scars. And also it didn't last very long because once the skin re-stretched, you were back to where you started. But resuspending all those tissues is really the key. And that's a layer which is called the SMAS layer, which is under the skin, deeper to the skin. And it's involved really around the muscles of the face that move your face. And it's just a matter of resuspending that, is to reset people's structure, and then the skin is redraped over that. So it's an operation that, as I said, takes about 4 to 5 hours under a general anaesthetic. Most people stay in hospital just one night and go home the next day. It's much less painful. People are expecting it's actually not a very painful operation at all. If anything, there's some numbness after the surgery, particularly on this part of the cheek or the ear, can sometimes have some numbness, which is relatively short-term, recovers within a few weeks in general. And most people go home, they're a little bit bruised. There's no extra dressings or anything on, nothing apart from the surgical wound. I then see people at about a week after surgery and take out a couple of stitches that need to be taken out, and then it's just a matter of them recovering and the swelling settling down. And once again, usually within about 2 weeks, most people can go out in general public without anyone suspecting they've had any surgery undertaken.